It's interesting, actually, because according to anecdotal evidence, there is actually hypertension does not cause epistaxis on its own. There's no association that has been found between the two. However, patients that have hypertension and happen to have epistaxis or nose bleeding, it is more difficult to treat. It's what we call intractable bleeding. And some of the factors that we had alluded to earlier is some of the drugs that they're using could contribute to this relationship between the two. And it's more common, especially in the older adults, in patients that have hypertension, as opposed to those that do not have the hypertension. So it's important for these patients to seek medical attention and not assume it, because it is more, as we said, more difficult to treat and will probably not be as effective with the first aid measures done at home.
I know everyone is waiting to hear these first aid measures, because sometimes we feel we're doing stuff right until the doctor says, well, that's been making it worse. All right, now we're going to go into that. But of course, Dr. would you like to add anything on the hypertension relationship, or Dr. Angela is clear on that?
Yeah, she's clear on it. The only thing would be maybe just to emphasize. Most people think because they have hypertension, then it's the one causing the nose bleeding, as she's already explained. But then maybe just to get deeper into it, then you find the hypertension usually affects your blood vessels. So you have things like atherosclerosis, which is now which is now a deposition of like plaque-like substances on the walls of your blood vessels. So